14 days na kakailanganin niya in a hospital setting. And of course, ang mga LGUs po natin, meron pong operation center upang magkaroon po ng trafficking of patients. Meaning to say, kung heto si pasyente A, galing po sa cluster clinic o galing po sa isang lugar, ay kailangan po ng admission at kailangan po ay sa hospital setting siya, ay yung operation center po siya ang magbibigay ng direction kung saan po dadalhin yung pasyente upang maibsan po yung waiting time sa emergency rooms o kaya naman para pumila at hindi na sila pumila ng matagal po doon at maasikaso naman sila. So I believe, no, ang Department of Health din po nag-deploy po tayo ng additional manpower to the private hospitals. Nagbigay po tayo ng mga PPE, sabi nga po ni Asset Junji kanina, nagbigay po tayo ng mga PPE sa ating mga pribadong ospital. As of today, ito po ang ating number of na i-deploy natin ng mga nurses, no, sa ating mga partner private hospitals. Total number of 239 already. May additional pa tayong requests na mga around 28. Ang ating pong mga kasamahan sa Armed Forces of the Philippines, nagbigay po ng 6 na doktor, 6 na nurses, at 8 pong aid, no? At si Department of Health din po dito sa Region 7, nag-deploy na rin po kami ng 25 additional doctors at 2 pong deputized physicians. So having said that, I think that's my report for the status of Region 7 sa Cebu City particularly. I'd like to go to the next one, which is the convalescent plasma. Alam naman po natin lahat ngayon na lahat ay gusto ng convalescent plasma. Although gusto ko pong sabihin sa mga tagapagpanood, hindi pa po talaga proven, no, na it's a treatment or a therapy for COVID-19. But then it has its own usefulness. That's why we are really promoting convalescent plasma. In my meeting attended this morning with NVBSP and PBCC, I would like to announce already that the Subnational Blood Center, which is here and in the Department of Health, is the only licensed and authorized and accredited convalescent plasma facility. And so as such, the challenge is for us to be able to, lead this program so that everybody would have a chance and an opportunity to have that most valuable plasma if they need it so. So ito po yung aming ginagawa ngayon. Meron po kami mga protocols and guidelines na ginawa. Kanina po, may meeting po ako kanina kasama ng ating mga LGUs, no? From Mandaue, from Lapu-Lapu, ang LGUs po natin, DILG, PNP, AFP po, no? At DSWD, at kasama po si OPAG nitong ating project for the convalescent plasma. Ngayon po, ginagawa po namin ang aming mga networking for this. Now, another thing is, we would like also to invite, no, heto nga po ang aming gustong iparating talaga, that blood is essential and vital, pero hindi po dapat ito binibenta. We should only accept voluntary blood donations. Ayaw po namin na ang dugo po ay ibenta kasi po it will destroy the programs that we have already been setting in place. Kaya nga namin gagawin itong magandang networking namin for the convalescent plasma because we believe that everybody has a right and should be given that opportunity for that basic and most essential commodity, and that is the plasma for those who will need it.
So, thank you very much, Dr. Loreche, sa pagbibigay po ng impormasyon sa kasalukuyang sitwasyon sa Cebu City. Nais lamang po naming i-note, no, at maintindihan po ng ating mga kababayan na maaring may bahagyang pagkakaiba sa mga numero na ipinakita po ni Dr. Loreche at sa numero na meron po tayo dito sa DOH Central Office sapagkat po ang ating regional offices ang mismong nasa ground at maaring may access sila first-hand sa information at data na hindi po ganun kadali na nakukuha dito sa Central Office at ibinavalidate pa ho ang mga numero dito. Our next speaker is Dr. Potenciano Yong Larzabal III, President and Chairman of Cebu Doc Group of Hospitals na magbibigay po sa atin ng update tungkol sa health capacity ng Cebu City Hospitals. Dr. Yong? Good afternoon po, Dr. Yong.
Okay, good afternoon, Yusek. Thank you for inviting me here.
Good afternoon, sir.
Can you hear me? Okay. So since the start of the pandemic, the private hospitals have only allotted a few number of COVID beds, no? And then when this started, we actually didn't have any patients, so we didn't really get much as far as beds were concerned. It was only after GCQ that the demand for the COVID beds increased. No? But the problem is, simultaneously, there were a lot of resignations because in them, a lot of nurses were afraid. No? So that's what happened. No? There was a sudden influx of patients, and most hospitals weren't prepared. It isn't that hospitals were full. It's just now we weren't able to allocate as much COVID beds as what we would have predicted to have happened. So can you show my slides? I have some slides. Okay, so first here is we're so thankful that the Army and Navy have sent doctors and nurses. No? This was taken the other day. This was a very big moral booster, no, to our current staff. No, it actually lifted the morale because we are low on nurses and we are low on doctors. So seeing them alone has made a big impact on the morale of our staff. No? Okay, next photo, please. Now, because the problem with the private hospitals, the ER, we had to subdivide the ER into a clean ER and a COVID ER. So, in effect, there were very few clean cases coming into the ER because most of the clean cases were afraid, not the patients. So what happened was a lot of ER COVID patients started coming in, but there were not enough ER beds. So a lot were waiting in the ambulances, no? And this was posted on social media, which alarmed further the public because you'll see patients na nakastay lang sa ambulance waiting for several hours. So what we did, with the help of OPAV provided us this tent, and we constructed this, and this will be operational by tomorrow. This is ER bed for clean cases. So what happens is our main ER now becomes entirely a COVID ER. So in that case, this will have lesser patients waiting outside the ER. Most will be accommodated already inside the hospital. Next slide. Because there's a demand for COVID beds, we're continuously creating COVID beds. No? Like this case in Cebu Doctors University Hospital, we are making a 50-bed COVID charity ward. No? This will be done next week. No? Of course, we cannot open this until we get more support from DOH. No? DOH has promised to give us more nurses. As long as the DOH or the city can help us with more nurses and doctors, we can actually open more beds. No? That is our job as private hospital providers, no? To provide more beds for the community. No? We can do that. We just need help and support. Next slide. Because we are a branch of 7 hospitals, we have hospitals in Negros and in Leyte, no, that aren't as badly hit with COVID. So here are our volunteer nurses from Ormoc. No? They bravely came here to support the Cebu Doctor Group hospitals here in Cebu City. But they had a problem coming here, no, because of transport and clearances. So we're so thankful that OPAV helped us with this. No? They immediately were able to deploy the nurses here, and these were able to help our staff. No? So we're able to open more beds and to man more stations because of them. Next slide. Now, also, when the number of COVID regular beds also increase, naturally, exponentially, the critical cases also increase. No? So we've modified our ICUs here. This is a new ICU for COVID. On the left side are the cubicles. On the right side, where the nurses station is, it's totally walled off with windows, so that consultants can come back in and out without having to change PPEs, so they can watch the patients from the windows. So they're facing each other. Next slide. Now, this is how the COVID tent, the emergency room, looks like now. No? So hopefully tomorrow we'll start receiving patients without COVID, and then we can separate already. Patients who are clean will go to this tent, and patients who have COVID will go to a regular ER already. That's 25 beds. Next. Okay, that's it. Okay,
Yeah.
anyway, we're thankful that the DOH has sent us nurses already. They've so far sent us around almost 40 nurses, spread out to our different hospitals. It really helped us a lot. We were able to open more beds, but as mentioned by Yusek John G earlier, that a lot of nurses were already comparing salaries because the salaries of the government nurses are already very high. But I've learned good news today. Mayor Labella has mentioned that he might provide incentive of 10,000 pesos a month for the nurses in the private sector. So this will approximate already the salaries of the government wages. So this is a very big help for us as well.
So thank you. Thank you very much, Dr. Potenciano Larzabal, Dr. Yong. Maraming salamat. It is good to know that Cebu hospitals still have enough capacity to respond to the pandemic. So dahil po sa magnitude ng virus na ito sa ating bansa at sa buong mundo, ang impact na ito ay hindi lang po nakakaapekto sa health sector, ngunit pati na rin po sa ating ekonomiya. Upang makapagbigay po ng impormasyon ukol dito, kasama rin po natin ngayong hapon si Mr. Virgilio Nonoy Espleta, Chairman of the Economic Development Committee and the immediate past President of the Cebu Chamber of Commerce and Industry Department. Good afternoon po, Chairman Espleta.
Good afternoon, and thank you very much for having me here. And here in the business sector, we have been really disrupted, and in fact, for 4 months already, we have not been operating some, except the essential businesses, but most of us are not operating our businesses. Well, COVID-19 started just before I ended my term as CCCI president, and I speak in behalf of our new president, Felix Tagyam, and the 900 member companies in all the citizens of Cebu to unite and work together in addressing this pandemic. Can I have my slide, please? We've been helping the government, the business sector. We've been consulted, and we have worked together with the Office of the Presidential Assistant. We had projects like the Project Palikbuhay, but there were many things that we would have wanted to do, but there were just a lot of circumstances that we were unable to really execute our plans because of certain issues. But now we have to work together in addressing this pandemic. We cannot be divided. We have to be united to have a collaborative, programs to save Cebu and the economy. We worked hard for years. While we thank the national government for the special attention and support, CCCI together with the church, the Cebu Medical Society, and are one in adopting a holistic, integrated, and collaborated approach, first and foremost, for the sharp, drastic reduction and flattening the curve of transmission. Second, a well-coordinated, informed, and enabled healthcare facilities, both for private and public, and strategic ramping up of the economy. We cannot just focus on the economy, but we need to look at the healthcare system as well as on the public side. And finally, also to also support our leaders, governance and strong leadership support. The framework that I have presented here, we are adopting with the Cebu Chamber of Commerce, and we are trying also to, also use this in our collaboration efforts. This may not be exhaustive, however, this provides us with a checklist, a guide to determine what help is needed, from whom, to whom, and for other citizens and institutions to come in and offer help. We may not be able to do all of them, but we exhort those who are capable of helping to come forward to help, while we influence LGU in government agencies to see execute the tasks under their mandate. In short, let us be partners in this endeavor. We are thankful that a movement is snowballing and gave birth to the Cebu Citizen Initiative. Next slide, please. If only I have time, I would have wanted to discuss the framework, but we are not in a seminar right now. But we've submitted the framework. I think even General Simato and have already copy of that, and the mayor as well. So we are thankful that the movement is snowballing and gave birth to the Cebu Citizen Initiative. This is a civil society campaign for unity and solidarity with Archbishop Jose Palma as our shepherd and servant leader volunteers from kapisanan ng mga broadcasters ng Pilipinas, Cebu Chapter, Rotary Clubs, JCs, SEYAP, University of San Carlos. We also have CREBA. We have the Professional for Active Citizenship and Transformation. And we are joined here by many sectors for the initial works. And I am calling other institutions to come and join us in the areas stated. Our initial collaboration, we are the communications group. We launch a daily radio, TV, social media, fostering for massive education, information, update drive for the general public on how to curb transmission and also to influence behavior of the public so that health protocols of social distancing, wearing of masks, sanitizing, etc. are being implemented. Secondly, we recognize the immediate need to help our healthcare professionals. Hence, we shall appeal for financial, material, logistical supports, help establish even two off-site dialysis centers with Go Negosyo, Project ARC, and also the conduct of pool testing. We also support DOH with what Dr. Jean earlier said, the blood plasma bank, among others. To the government, the LGUs and other agencies, we offer our advice, our talents as volunteers to assist you in governance work and of course in crafting the local level economic stimulus programs. And we shall ensure and self-audit our member companies to comply with new work health standards and protocols to avoid workplace transmission while ramping up our business operations. So these are a few of the initiatives, and we want that all sectors work together with us so that we'll be able to help, to help the government, DOH, LGU, and all other sectors. We should work together and heal as one. Thank you.
Thank you very much po, Chairman Espleta, sa inyo pong impormasyon kung paano po nagko-cope ang business sector sa Cebu City. Maraming salamat din po sa inyong lahat dahil po nakasama namin kayo ngayong hapon na ito. Pero bago ho tayo magkaroon ng huling mensahe, gusto lang ho namin magtanong sa inyo ukol po sa mga ilang katanungan ng ating mga kababayan. Umpisaan ko po kay ASEC John G. ASEC, sa paano pong paraan magkakatulungan ang public and business sector upang maging parte po ng solusyon sa laban natin sa COVID-19? Paano po kaya mababawasan ang adverse economic impact ng pandemyang ito sa atin? ASEC John G. ASEC John G. ASEC, nakamute yata po kayo.
Two things, Yusek Vergeri, prevention and early diagnosis. No matter how prepared Cebu City is, even with the help of the national government and private sector, if we do not promote behavioral change, because this will definitely be a long haul. And until we have a vaccine, we therefore encourage the continued support of the business sector and the information offices of the national government agency through their corporate social responsibility. We should create together a massive information drive. Wear masks, social distancing, proper hand washing, and follow strictly the health protocols. Discipline is the key. For early diagnosis, dito kami sa Cebu and the Visayas, we have augmented our testing in Visayas even before the national government stepped in. To augment the testing capacity in Central Visayas and Western Visayas, Christina Lee Dino Foundation through OPAB donated 3 RT-PCR machines, 2 of which were given to Cebu TBRL, and 1 to EVRTC Region 8, 2 automated extraction machine, 20,000 test kits, 12,500 extraction kits, and 18,000 swab kits distributed across the Visayas region. I urge the business sector, even the NGA's information offices, to align with government and produce communication campaign on prevention and early diagnosis. If we do not do this together, we will just get sick. We will also not be able to put back to good health our ailing economy. Our dear President Duterte and Senator Bongo and the DOH are doing their best together with the entire cabinet and the government bureaucracy, including the business sector, so that we will win against this pandemic and we will heal as one. Yusek Vergeri.
Thank you very much, Asek John G. Suportado po namin kayo dyan po sa mga sinasabi nyo. And hopefully nga po, ito pong ating panawagan na magkatulong-tulungan tayo with the other sectors of society para po naman magkaroon na ho tayo ng ease dito po sa ating pandemic situation ngayon. Thank you, Asek John G. Now, can we ask Dr. Loreche, sa mga nagnanais pong makatulong at gustong mag-donate ng kanilang plasma upang gamiting panggamot sa mga pasyente, paano po nila mapapadala ang kanilang tulong sa Cebu patients? Dr. Loreche?
Okay, kami po ay nagpapasalamat doon po sa mga gustong mag-donate, So pwede naman po yan ipadala diretso po dito sa Subnational Blood Services Center natin, dito po sa loob ng compound ng Department of Health sa Region 7. But then kami po ay nananawagan din po sa mga donors natin, hindi lang po sa ating convalescent plasma, kundi para po talaga kailangan po natin ng dugo. I keep repeatedly saying this, and I even went to see Sec Mike Dino, and Asek Junji was there when I was, appealing to them and asking for their help, which they have given us naman, that the rainy days are here, dengue season is up again, and there will be operations, there will be patients who will be needing, especially the dialysis patients who will be needing blood. Sa kaalaman po natin lahat, ang Subnational Blood Center lang po ngayon ang gumagana na blood center sa Visayas po, kasi ang iba po ay hindi po muna nagba-bloodletting, nakafocus po ang lahat sa COVID, at naiintindihan po namin yan. So kami po ang nagsusupply ng mga pangailangan dugo, both sa private at sa public sector po, So kailangan po namin ng mga donors po na dapat tumulong po, kasi malay natin, minsan ikaw naman po ang nangangailangan ng dugo at kaya po natin ibigay yan kung tulong-tulong po tayo.
Thank you, Doktora. Susundan ko na po ng isa pang katanungan. Nabalita po sa atin ni Secretary Duque at ni Yusek Vega kahapon mula po sa kanilang pagbisita dyan sa Cebu kung paano po nakakapacitate ang ating government hospitals to help Cebu City, particularly Vicente Soto Memorial Medical Center. How are the supporting private hospitals there?
Maganda po talaga na hetong Vicente Soto po, being a level 3 also, na-convert naman po natin ito as a COVID hospital. Kaya sabi ko po kanina na mas madali po siyang mag-expand, Kasi meron naman po siyang adequate manpower, meron naman po siyang mga specialista, kanyang pong mga equipment, ang kanyang mga PPEs and supplies, nandiyan naman po. Even ang mga gamot na kakailanganin ng pasyente. So yun pong mga pasyente na galing po sa mga pribadong hospital, kung sila po ay nangangailangan na ilipat po sa ating government institution, kayang-kaya po yan ng ating mga specialista sa Vicente Soto. One other beautiful thing with Vicente Soto is this: meron po silang area, no, na parang it's a step-down facility na sila din po ang nagmamanage nito. So for those patients na pwede na pong ilipat, no, dito para lang matuloy ang kanilang pagpagamutan, whether they're moderate to severe, no, na ililipat na po nila because this facility is also manned by the manpower or the healthcare professionals of Vicente Soto.
Thank you, Doktora, no, for that answer. No? Nakikita ho natin talaga yung suporta, especially by our government facility in Cebu, para po mabigyan din ng tugon, no, itong atin pong sitwasyon dyan sa lugar ninyo. Dr. Yong, para naman po sa katanungan po sa inyo, paano daw po makakalahok ang mga interested frontliners na tumulong sa Cebu para sa COVID-19? Dr. Yong?
Yes, we need all the help we can get. No, as what I said earlier, it's a race against time. No, the worst thing that can happen to is to create panic and chaos when people can't get into the hospitals. It creates a lot of chaos and panic. So, as hospital providers, we are racing against time to provide more beds. No, for more we can accept more COVID cases. But at the same time, beds are useless if we don't have doctors. So if doctors can volunteer, we'll gladly accept them. We'll even house them and they'll provide meals as long as they can help us lang talaga. No? And we're very helpful that the DOH has sent a lot of nurses to us. In that way, we'll be able to accept more and more cases. No? At the same time, we're trying our best also to protect our frontliners, no? Our nurses, our doctors who haven't seen their families for as long as 3 to 4 months already. We're thankful that they're still in the fight with us. We should support them and protect them and provide them with very good PPEs. We bought a lot of respirators lately for them. And then to show them also that they're not alone and we're gathering even more help from the DOH, from the Army, from the Navy, so that their morale will be lifted and they will be able to help more, no? In that way.
Thank you very much, Dr. Yong. Sana nga po, no, matulungan po natin ang ating Cebu City at ang ating mga facilities doon para po sa mga volunteer na mga healthcare workers para mas madagdagan po ang kanilang health human resources for health at nang makaagapay po tayo dito sa mga lugar na ito. And lastly, Chairman Espleta, ano po ang inyong mensahe sa mga business owners at sa publiko ngayon pong nagbabalik na ang pagbubukas po ng ekonomiya? Chairman Espleta.
Yeah, bago ko sagutin yan, gusto ko lang suportahan yung ang sinabi kanina ni Asek John G. When we talk about massive information drive, the group, our group has already mobilized 15 radio stations, which will air 1 hour per day, and we invite experts in health, civic leaders, sectoral leaders, and tomorrow we start with Archbishop Jose Palma. You will hear that in DYRC, DYLA, DYAB, Yes FM, Yes Best FM, Monster Radio, DYRF, and all other KBP radio stations. I think 15 of them will hook up. So we will do this massive information drive to also educate and to make sure the behavior of our people, we try to convince them, we try to make them, follow our protocols. Secondly, yung sinabi ni Dr. Jean, binanggit ko kanina yung support ng plasma. We've been talking about it. I'm very happy that you have taken this as a special project because our past presidents have been egging to help you on this. No? Because one of our past presidents is right now in the ICU. And he was just, Dr. Yong knows about this. No? And I think he was just infused plasma. And thirdly, also, we are working together with DOH in setting up the 2 off-site dialysis centers, hopefully one in SMCT side, and the other one, hopefully we're negotiating with another mall. And this is in cooperation with Go Negosyo, Project ARC, and also pool testing. We have been helped also by Congressman Garin. And to your question about the advice to the business, can I just please show my last slide? To the business owners, we know that we have incurred unimaginable losses in the past 4 months. But up to the last mile, up to the last blood, we should survive. We should help each other survive. Profit is a bonus na lang. As many of you, many of us say, 2020 is already down the drain. What we need to do is just to survive. If there is profit, that is a bonus. Let us ensure that while we prevent virus transmission in the workplace, our obligation to our workers extend beyond paying their salaries. Let us take care of our people's mental health as well, as we know that many of our employees are even afraid in coming back to work. They are scared. We need to build confidence for our people and for our customers. Let us make testing, tracing, and treating the new normal protocol as we reopen our businesses. We are lobbying that every establishment should endeavor to have their workplaces be certified safe. In the Chamber of Commerce, in fact, we initiated and we are asking our member companies that they should appoint a HIPCO. We call that HIPCO, Health and Infection Prevention Control Officer, who will oversee, to make sure the implementation of the new work health standards are being done. And we will rate them accordingly. It's not only mere compliance, and we would like you will be rated as far as the compliance, no? May star rating yan, no? And I've discussed this with the mayor about putting this as a, as a requirement. No? Maybe some businesses may not like this, but reality is this is the new normal, that we have to be certified safe. Let us have our workplace be certified safe as we rebuild confidence and the image of Cebu. This is a concern for us because we have been building a very good image in Cebu. We have been campaigning for this good image, and now we need to work doubly hard so that we will recover that confidence and the image of Cebu as a place to revisit, a place to invest, a place where life and livelihood could resume its balance. Let us work together. Let us heal as one.
Susunod na programa ay rated PG. Ito ay nangangailangan ng patnubay at gabay ng magulang para sa mga batang manonood.